any disease that can be treated with minimally invasive devices and image guidance, intervention radiology can do that. Leaving out the heart, we do everything from the brain to the abdomen to the lungs and diseases of the blood vessels. So today, some of the most common procedures we do includes something called prostate artery embolization, where it's a common condition called benign prostatic hyperplasia, where patients above the age, men above the ages of 50 have prostate enlargement. So traditionally, these were being operated through surgery, which involves going through the urinary tract and removing the prostate tissue or using laser and shrinking it. So with intervention radiology, we are able to use the blood vessels, which are natural pathways, where we use a 2 mm access, a pinhole access from the groin or from the hand. We go through the blood vessels, we actually identify and image the blood vessels of the prostate, and we are able to use tiny particles called embolics, which naturally integrate into the body and do not cause any kind of reaction, to block the blood vessels of the prostate and shrink the prostate. So what this allows is a very quick recovery for the patients, no blood loss, no anesthesia, patient is out of the hospital the same day, and they tend to see results within 3 to 4 weeks, and the results generally tend to last for years. And also there are other common things like uterine fibroid, which if you see, almost 60% of the women in reproductive age actually suffer from uterine fibroids at some point in their life. So the other option for uterine fibroid is something called uterine fibroid embolization, where instead of surgery, we are able to go into the blood vessels and cut off the blood vessels supplying to the fibroid. So this causes a natural shrinkage of the fibroid, and the symptoms of the fibroid like pressure or pain or bleeding, they tend to go away over weeks to months. So, and there's also something called thyroid nodule ablation. If you see, thyroid nodules are one of the most common conditions to affect like people, where at least if you see, maybe about 20 to 30% or more in their lifetime will have thyroid nodules. So traditionally, thyroid nodules were operated and the thyroid gland is removed either partially or completely based on the number of nodules. So with something called thyroid nodule ablation, we are using a pinhole and image guidance to go in and generate some heat and shrink these nodules without surgery. So patients can actually preserve their thyroid gland and avoid having to take thyroid hormone supplements lifelong, which often happens with surgery. Similarly, one of the last thing that I want to mention, something that is really upcoming and very effective, is genicular artery embolization for knee pain. So this has been evolved over the last 7 to 8 years. It's a Japanese technique, and if you see, patients who have gone through all the options of pain treatments for knee and they don't want to get the surgery right away, so we are able to go and block the tiny inflammatory blood vessels in the knee, and we are able to give pain relief for years in many of these patients. So this is not an alternative to knee replacement, but it's a option for patients who don't want to get it right away or are too old or unfit to get surgery. So these are the common conditions that intervention radiology can actually today help patients with. Accessibility to intervention radiology is a problem, Andy, especially in India. While all your metropolitan cities and tier 1 cities have adequate, well-trained intervention radiologists and the imaging equipment necessary for treating these conditions, if you go into tier 2 or tier 3 cities, yes, the number of trained interventional radiologists that are readily available has been a problem. But another bigger challenge is, even in places where there is adequately trained interventional radiologist, the challenge of patients being aware of this specialty and what it offers is one of the main factors restricting accessibility to our procedures. While uterine fibroid embolization is being offered from a long time, because of lack of awareness amongst patients, they traditionally tend to go for either removing the uterus or some uterine sparing treatments like myomectomy, which involves surgery and a longer recovery. So generally, for most of the conditions we treat, there is an awareness issue, and once patients know that there is an alternative to surgery, they generally tend to opt for these procedures, because these procedures are designed to be patient friendly, they're designed to be minimally invasive, and they're designed to have the quality of, to preserve the quality of the life of the patient during the treatment process. So many patients, once they know that there is an alternative to surgery, they tend to opt for these treatments.